about the special diet and the fight to raise welfare and disability rates in Ontario. And specifically, we're going to be hearing testimony from people who are getting cut off the special diet. And hearing testimony about the impact that that's going to make on people's lives. We know that in the last provincial budget, the Liberal government decided that they were going to cut the special diet completely. When that's going to happen exactly, we don't know yet. We know that it's supposed to be over the next few months. We don't know how much notice people are going to get. We don't have that information. For now, what we do know, though, is that this is a huge welfare cut. And it's going to have a major, major impact on people.
Shut down the city, that's what.
And we're going to talk about strategy and things coming up, including April 15th, an action to raise the rates, and that's an OCAP action starting out at Allen Gardens, and hoping that we'll see all of you there. But in the meantime, we're going to hear testimony, and it's going to be, it's rough to hear the impact on people's lives, because it is, for a lot of people, it's being on the edge of homelessness or losing housing again, potentially. And it's food on the table, and it's really serious stuff. When we're listening to that and talking about those impacts, I just want us to remember, though, that before this campaign to get people on the special diet started, there was $6 million a year being spent across all of Ontario on the special diet. $6 million. That was in 2004. This year, there was $200 million being spent on a special diet. That's what we won. In 2005, when we started the campaign and health providers were coming out and getting people signed up at clinics, immediately they wanted to shut down the special diet. That very first summer, they tried to change the whole program. They tried to change it so nurse practitioners and dietitians and midwives could no longer give it out. And they lost that fight. And they tried to change it immediately by reframing what the special diet would look like. And they weren't able to win. And so they have won eventually. For now, they have won. But $200 million last year, and hundreds of millions of dollars every year through the years, all the way from 2004. That's what we've won so far in the campaign to raise the rates. So let's maintain it in that perspective, okay? So we're going to hear from a bunch of different people. If you want to speak, please throw up a hand, let us know, and be happy to put you on the list. The first person who's going to speak from Sistering is Linda McNeil. Linda, come on up. Welcome.
Hi all. As you all know, I'm on disability. I'm on disability due to a chronic disease that only allows me to work casually. I also volunteer. Trust me, I'm sure you all know being on disability is not a livable allowance, especially with the cost of living continually increasing. The medical community wanted to put me on Percocet for my pain. Fortunately, my body doesn't agree with Percocet and opiates, and I was granted the use of medicinal marijuana. I'm able to function on this medicine most wonderfully. However, it is not covered. I have to pay for it, and I can't claim it on my taxes, so that comes out of my allowance. Anyways, it's obvious that what is given by both OW and ODSP is a pittance. I'm going to end by saying that I'm livid that the special diet allowance has been cut. I used to weigh 260 pounds, and presently I'm about 135. I'm sick and tired of being on the I can't afford to eat diet, especially when 63,671 civil servants are on the sunshine list. Makes me ill. How about you? Thank you.
Thank you so much, Linda. Our next speaker, also from Sistering, is Laura.
Hi, my name is Laura. upset with the government because the powers that be have decided to cut the special diet funding because it is costing them too much. While I say too bad for them, I need that extra money to survive. With that money, I am able to buy proper food and still pay my bills. It basically gives me breathing room with my finances. Now I don't know what I'm going to do. I feel it is another way for the government to screw the poor. Thank you.
Hi, so I'm also getting the special diet. Whoa, don't lean on this. And like the other 62,000 people in this province that depend on that money for food, when it gets cut, I don't know what I'm gonna do. My rent is more than the 450 or so bucks that I get from ODSP for rent. The average rent for a one-bedroom apartment in this city is $927 a month. Nobody gets enough money to be able to pay for their rent and eat food, and particularly the healthy food that many people who are poor in this province desperately need to be eating. It's incredibly shameful and disgusting that McGuinty has chosen to attack us, the poorest people in this province, to help pay for a budget crisis that was caused by rich people. Rich people are benefiting, they're continuing to get exorbitant salaries from the provincial government. Like someone already said, there's 63,000 people that get over $100,000 a year, and there's only 62,000 of us that get between 10 and 250 bucks a month for food, and we're the ones that they're going after. And I don't think that any of us who are going to lose this money can just sit by and watch it happen. I think that the only chance that we have of keeping this money, and certainly the only chance that we have of getting enough money to actually live, is to fight back. And so that's why I'm going out on April 15th with OCAP to demand a raise in rates for everyone, and to demand that the special diet not be cut. And please, everyone, join me and join all of us and bring everyone that you know. This is our last chance to try and keep the special diet, and we desperately need to keep it. Thanks.
Last time they cut the special diet, my husband was just coming out of the hospital after being in for a heart attack. He just about died at that point. He was put on a salt-free diet by his doctor. All the food that we had at home had tons of salt, and he couldn't eat it. And he was forced to eat it just so he wouldn't die from hunger. He had to put his health at risk just to stay alive. Now they're going to cut it again, and he's facing the prospect of another heart attack. He doesn't need this kind of stress. He's supposed to be avoiding this stress like this, not knowing what's going to happen. I belong to an email discussion, ODSP email discussion list. People on there are saying that they're contemplating suicide because they don't know what to do. This has got to stop, guys. This is not the way we're supposed to live. We're not supposed to be worrying about our health and everything else. They don't realize that they're saving money now, but they're going to be paying more money in health care costs later. If they give us the money that we need now, they can save money in the long run. Duh. We need to look at people in France. And the people in France, if they don't like something, they get out and they fill the streets every day until they get what they want. But we need to do that. Let's get out there and fill the streets. Now let them know that we're not going to take this time. People were silent the last time. We cannot be silent this time.